COVID-19, a rural health community engaged response. Community engagement is
vital to the growth of a city.
Valuing everyone's commitment, their voice, and building long-term relationships.
Community empowerment.
Bringing people together. It's creating a sense of belonging.
It's the right of every community member to be involved, consulted, informed, and empowered.
CDC defines community engagement as the process of working collaboratively with and through groups of people affiliated by geographic proximity, special interest, or similar situations to address issues affecting the well-being of those people. So, why community engagement? Well, one, as CDC notes, because partnering with the community is necessary to create change and improve health. And it's the worldview we live by here at the West Virginia School of Osteopathic Medicine Center for Rural and Community Health. Over the next few minutes, we'll first describe some of the response projects that we've been engaged in over the past year here at CRCH. Then we'll talk about our center's mission and approach, and we'll end with a discussion of best practices and strategies for employing a community-engaged response. By the end of our presentation, we hope you have a better understanding of working with rural communities, especially in the context of a public health emergency.
When COVID-19 started to infiltrate Greenbrier Valley in March 2020, our Center for Rural and Community Health grew busier than ever. Through established partnerships with critical agencies and stakeholders across our grassroots communities, our county and state, CRCH has supported local response efforts to streamline response projects, resources, data, and expertise through the Greater Greenbrier County COVID-19 Task Force, boost countywide mask wearing through the Mask Up West Virginia Public Health Messaging Campaign, assemble 1,500 3D Montana N95 masks and face shields for PPE reserved for local first responders and medical providers, sponsor PPE for county EMS and emergency services organizations, distribute food and safety packs to our essential truck drivers, share physician guidance on COVID-19 precautionary measures to thousands of stakeholders through advice from our docs, coordinate data management and volunteer support to disperse over 60,000 student meals through the Greenbrier County Schools Feeding Program, provide technical assistance in delivery of more than 7,000 locally sourced meals and wellness checks through Feeding Seniors Saving Businesses, assist in provision of an additional 3,500 locally sourced meals to seniors and families in need through MRV Meals, raise over $16,000 for local food charities through a 24-hour socially distanced race through Feed More and 24, and educate youth groups on the importance of masks and COVID precautionary measures through Be Kind.
Today, CRCH partners with the Greenbrier County Health Department on the local vaccine rollout, scheduling thousands of vaccinations through a CRCH hotline and data management system implemented in January. CRCH also works with the Partnership for African American Churches and Race Matters in Greenbrier Valley to host vaccine clinics for folks of color at our Klingman Center for Community Engagement. Remarkably, if West Virginia were a country, our vaccination rate would actually be top 10 in the world.
So how are we doing it? How is our center, our county, and state such a front runner in COVID-19 response? We think it's the West Virginia commitment to community engagement and to our community partnerships and networks. And we're going to illustrate this here through CRCH. The Center for Rural and Community Health was founded in 2010 as a special community resource hub of the West Virginia School of Osteopathic Medicine. And today we drive engagement in rural health across the region by building an infrastructure with communities to reach their highest level of health through evidence-based education and training, research and scholarly activity, engagement and outreach, and population health and special projects. And we carry out this dynamic programming through program and project management, technical assistance, professional development and training, grant writing, research and data management, policy, and collaborative community spaces and supportive platforms, with the long-term goal to impact population health at the grassroots level. CRCH's programming and projects stem from our community engagement and outreach structure that demonstrates inclusivity across communities, from our grassroots networks to our medical communities and statewide partners. Trust, respect, and autonomy, whereby communities identify and take on their own priorities with our support and infrastructure building. Strengths-focused collaboration to intentionally tap into and promote agency, capacity, and leadership from within. And power and resource sharing through our dual service to our larger medical community on one hand and our grassroots communities on the other. We partner with each in their experience and expertise, collaborate across efforts to ultimately enhance the holistic health of rural communities.
So, from the CRCH Foundation of Operation, we pivot back to lessons learned from COVID-19. The pandemic has demonstrably reiterated that public health relies on trust. It has shown that not only do we have to pay energy to hard data, evidence, and scientific expertise, but that the ceiling of efficacy for a public health response is bound by community trust, partnership, and leadership. And these take time. And we argue they take community engagement. So, what are some strategies and best practices around community engagement?
In light of COVID-19, the World Health Organization's latest risk communication and community engagement framework lays out 4 strategic objectives in response. That efforts are community-led, data-driven, collaborative, and reinforcing of local capacity and solutions. And we believe these tie in nicely with the best practices we've emulated in COVID response since spring 2020. First, activate your engaged communities and community engagement strategies. Our guiding community engagement approach cannot be overstated and is an ongoing, fluid, active commitment during, pre, post-crises, and all times between. So the start for us was and always is rallying our engaged communities and ramping up those community engagement strategies across our networks. Second, launch communication information channels. Through the Greater Greenbrier COVID-19 Task Force, the county has sustained a centralized communication and information hub that has been crucial to mitigate risk and streamline and disseminate information and resources through channels that are trusted, understood, and accessible. Third, connect essential goods, services, and resources, including meals, masks, testing, medications, and essential products where needed, as well as PPE and critical supplies for our frontline workers. It's also necessitated sharing and shifting resources where possible, like funding, facilities, technical assistance, staff and AmeriCorps and volunteer time, and marketing and visibility. And last, support incomes and economies whenever possible, so that the businesses, jobs, skills, and services we have help meet gaps and priorities throughout.
These best practices are part and parcel with the CRCH community engagement strategy, shown here in 3 parts. This strategy is the North Star for our work, and its importance has been constantly reinforced for us throughout COVID-19. 1. Coordinate, collaborate, and communicate. It may sound simple, but making sure that all community groups are invited to the table and have a venue to share information, find areas of common concern, partner on projects, and keep the community informed is vital. 2. Share resources creatively. Everyone has resources to share, and employing the 3 C's gets resources where they need to be. 3. Mobilize community partners. Tap into your community's unique strengths and assets.
Community engagement is power, and it's powerful. It's a means and an end, a process and an approach.
This is CRCH's account of an enormous county and statewide response effort that we're privileged to partner on among so many communities. None of this would have been possible without our Greenbrier County Health Department, county schools, EMS, and countless nonprofits, organizations, and volunteers. But our response story is really a West Virginia story, one of so many that demonstrates the substantial return and responsiveness that authentic and active investment in our communities and in community engagement can bring, particularly during the global health crisis of our time. And it's all made possible within the special context of such a resourceful and resilient and engaged community-first spirit here in Greenbrier Valley that we see and want to highlight across West Virginia, Appalachia, and the rural world.
The pandemic has taught us a critical lesson. A successful public health response demands trust. Investment in community engagement integrates community wisdom and priority with advances in science and medicine to affect real change on the ground, where people live their lives and respond to crises. The question at the heart of our center is really, how can we together impact the health trajectory of our rural communities? We would love to engage with you. Please visit us at crch.wvsom.edu.